So you just had a UCL repair with an internal brace augmentation, and you want to know how you get back on the field and what your progression looks like to get back to the field playing at the highest level that you potentially can. Let's get into it here. Dr. Max Wardell, physical therapist, former college baseball player with the Overhead Athletic Institute. We're talking about UCL repairs. A lot of times they're done with an internal brace augmentation now, but repairing your ulnar collateral ligament as an alternative to Tommy John surgery and what you need to do to get back on the field. So let's talk about the surgery first. I've had it done myself. I was probably one of the first baseball players in Michigan to have it done. It went really well for me. In the long term, you can see my nice scar here on the elbow. And that's kind of my baseball tattoo, if you will. But the UCL runs from right here, this bone, right over to here. And that's the portion of the UCL that we tear as throwing athletes. It kind of connects those two bones and stabilizes the inside of the elbow. When you lose stability on the inside of the elbow, you end up having too much gapping or opening force on the inside of the elbow, which can, over time, lead to compression on the other side of the joint, overuse of some of the muscles on the inside of the elbow, but ultimately decreased performance, speed, accuracy, and also pain. So what we do nowadays from a surgical perspective is athletes that are good candidates, meaning they have a tear at one end of the ligament, can undergo a repair as opposed to the full reconstruction or the Tommy John surgery. What they do with the repair is they take the ligament, your native ligament, and reattach it down to the bone. That's your primary UCL repair. And what we've started to do in our throwing athletes is we start to use this kind of cool stuff right here that's a tape. Now, there's different types. This is actually an Arthrex tape, is the brand here, and it's a collagen-coated tape. It's got collagen infused into it, which is kind of the building block of our connective tissue. And it's a very strong, I mean, you cannot rip this stuff. It's super, super strong. It can carry a huge amount of tensile loading. As you can see, I got it tied around a 60-pound dumbbell here. We're gonna lift it up so you guys can tell this stuff is pretty darn strong. That's the stuff that's going to kind of overlay and be integrated into your UCL to stabilize that joint. And what we've seen surgically is the elbows are a lot stable earlier on, which means you can get back to throwing sooner. Now, your surgeon might have said, hey, it's 5 months to get back to 100%, and that's not necessarily quite accurate. We've worked with a lot of these athletes, probably close to as many as anybody around. And what we see is with these UCL repairs, with the internal brace, is it's usually about an 8-month return to sport when you do everything right. A little longer if you don't. But then again, doctors tell everybody after Tommy John surgery that it's 11 months to get back on the field or a year, and the average in the MLB is 18.2 months. So a lot of times our surgical colleagues are not quite accurate with that. What a lot of times they're saying is it's a year before you really start training hard or throwing harder. Maybe it's 5 months before you can really start, loading this thing up and training really hard. But in reality, it's going to take you a few months to get back to your prior level of play. So let's talk about what you need to do to get to that level. So from an exercise perspective, after the surgery, you have to remember they cut through your muscles to get down to the ligament. So by creating this incision and cutting through your muscles, those muscles are going to become weak and inhibited. So you have to make sure you're maintaining your forearm strength and maintaining your grip strength early on. And we've done videos on this stuff in the past on different exercise progressions, so I encourage you to check that out. But you got to work on your grip, your forearm strength, and all of those things early on when you can't really do a lot else. As we get further into it and as you can start to move your elbow a little bit, we really need to train your rotator cuff hard. And this is the biggest thing that I see missed in therapy a lot of times is these kind of silly exercises where somebody's tapping your arm from different angles. People are doing all these different ball exercises and they're doing some wrist curls and wrist extension, and that stuff's fine, but we need something more advanced that's more specific to throwing, and that means you need to get your rotator cuff really strong. Use this opportunity to kind of fix some of your weaknesses elsewhere, your lower body flexibility or your thoracic or trunk rotation limitations. So you got to work on those things, but we really work hard with the exercises. The exercises have to be challenging. They should be so difficult when you walk out of the gym, you feel like, man, I just worked hard. Rotator cuff exercises, shoulder exercises, and then forearm exercises are really, really important to get your arm back in shape. And we just filmed a couple other videos on just UCL exercises for the elbow. You got to train really, really hard harder on your rotator cuff, harder on your forearm than you've probably ever done before to get them stronger than they were prior to your injury. And I would say the most important component long term is to make sure you perfect your throwing mechanics. Mechanics, I can't stress enough, are one of the most important things, if not the most important thing that you need to work on following this surgery. And that means while you're doing your interval throwing program prescribed by your physician, you need to make sure you're correcting your mechanics. That's why we put return to throw progressions on our website as different programs, and that's why we have our phase specific throwing program for guys that aren't in our area for this very specific reason. Now, a few things that are often overlooked in combination with this, beyond, just doing these kind of basic wrist curl, wrist extension, and, these perturbation exercises that don't really get you ready for the field, not only making sure your exercises are tough, but making sure you restore your full range of motion. When I see guys and they don't have full elbow extension range of motion after the surgery or full flexion, they're going to put themselves in bad positions as they throw the ball because they don't have the ability to either flex their elbow early on or get into that terminal end range position when they release the ball. You got to make sure you have full pronation, supination, extension, and flexion back, as well as full passive range of motion into internal rotation of the shoulder. So these are all things that you can't neglect in the rehabilitation program. If you guys like this video, hit the thumbs up, subscribe to the channel. We've got a bunch of videos on this type of stuff. I know there's a lot of people dealing with this stuff, especially pain after the surgery. So subscribe to the content here, and we'll see you guys in the next video.